Hi, I'm Ann Peterson. Welcome to Health Perspective by Blue KC, featuring advice from experts on a variety of health topics. It's the place where you get the direction you need to make good health choices. Today, Dr. Vickie Massey is here to talk with us about cancer prevention. Dr. Massey is a radiation oncologist who has been practicing for 20 years and is currently at Kansas City Cancer Centers. Thanks for joining us today, Dr. Massey.
It's my pleasure. Thank you.
If someone should get a cancer diagnosis, what is the first step they should take?
The first thing is to meet with their physician, and once the diagnosis has been established, then to proceed through and understand the staging of the malignancy, and then get with the appropriate specialist. Different cancers are managed different ways, so what would be appropriate for one may not be appropriate for another. For example, some cancers may be primarily managed with surgery as their first treatment step. Another, it might be chemotherapy. And so it would be important to know the diagnosis and then where it is. That's what staging is. It tells us, where it is in the body, and then get with the appropriate specialist.
And for family members and friends, you can feel so powerless, so out of control in a situation like this. What advice do you have for them in order to help the patient cope and deal with not only their treatment, but also recovery?
One of the biggest things is being there for them, and sometimes the patient doesn't even know what to ask for, and so sometimes it is going with them to an appointment and hearing the diagnosis and the discussion. One of the things we've known for a long period of time, and the number is different depending on which study you think about, but we know that when a patient is first diagnosed and we have a discussion with them, if we go back and we question them on what they understood from us, what they really understood is very little. Maybe they understood 25% of what we told them. And so having, what I always say is having that extra pair of ears with them is quite beneficial. And sometimes, too, just having the company when you're going through it is less frightening and helpful. The other thing is some of the treatments do have a lot of fatigue factor with them, and so having somebody that you can rely on to help you with some of your daily tasks, even simple things, is really very important. And just having somebody to listen to you and try to help you through it. Support groups also have been a tremendous thing for patients, just for the same reasons.
Dr. Massey, thanks so much for your time and this wonderful advice.
Oh, my pleasure.
Thanks for joining us today for Health Perspective. For more information on cancer, visit the Education Center at bluekc.com. Be sure to come back next month for tips on another health topic, and register on bluekc.com today to put yourself on the path to better health.